Hi, this is Bill, and welcome back to the Friends with Medical Benefits podcast. This is part two of our episode on medical marijuana. Part one ended when I was talking about how I thought maybe we went from one extreme to the other on marijuana, where it was too harshly criticized to now being given maybe too much credit. And we begin now with John responding to that.
You had a good point, Bill. There are a lot of people that are now saying that medical marijuana or marijuana in general can cure things. It has all these medicinal positive effects. And what I do want to be clear, there's not a lot of research on any of that. And I would not recommend anyone use that as a treatment for anything at this point until you talk to your doctor and we get more data on any of these claims. These are just random claims and they have no basis in medical fact. Also, the recreational use of marijuana, you had a good point. Alcohol, a lot of bad things happen with alcohol. But no less than alcohol, people that are using marijuana recreationally have to use it in moderation and have to know when and how to use it responsibly. You can't use marijuana and then go to work and expect to be functional at work. You can't use marijuana 24 hours a day and expect to be functional in a normal day-to-day lifestyle as we live it right now. But if you're having it at night to relax or to enjoy, for lack of a better, like having a couple of drinks at night, yeah, you're probably fine. The one thing that we're starting to find with overuse of marijuana, though, that people have to be aware of is a marijuana vomiting syndrome. And we started to see that. I think the first patient I ever saw with that was about 8-10 years ago. I had a young gentleman. He was probably in his mid-20s. He used marijuana very regularly, and he kept going into the hospital, and he was vomiting. He couldn't control it. And they would treat him, and they would treat him. And no one could figure out what was going on with him. And finally, one GI doctor figured out it was the marijuana and told him, look, you got to stop using the marijuana. He stopped using marijuana, and it improved. And now there is some research, and we're seeing more people going to ERs who are overusing marijuana, who are developing this vomiting syndrome. So that's something to keep in mind. If you are using a lot of marijuana and you're having a lot of problems with vomiting, as much as it helps in a small portion with nausea, there is this syndrome associated with marijuana. So it's something to consider and to talk to your doctor about and be open with them that you're using a lot of marijuana, because that might be why you're having problems with a lot of vomiting. So that's all I wanted to say about recreational marijuana.
Yeah, and it's interesting because sometimes medication has an opposite effect. Something that helps your nausea could create extreme nausea in overuse. And I've heard from a couple of people who have anxiety that the medical marijuana, or trying it as medical marijuana, actually made their anxiety worse. It had the opposite effects. And so, it really does depend on the person. But, I'll talk about my experiences a little bit, and I'll go back to that childhood, or that kid sitting on the tech bus with kids in the back getting high. I bought into all of the fear mongering. It's evil, it's dangerous, you're going to hell if you smoke it, you're going to be, if you're 16 using marijuana, then you're going to be 18 doing cocaine and 20 doing heroin and all of the other stuff. So I avoided it, but this is a little bit embarrassing, this story. I'm going to share it. It's embarrassing on two fronts, because it was embarrassing in the moment, and then it was embarrassing years later with a certain United States president. But I'll start with... I was terrified of it, but I also had no self-esteem. I had no, courage. So I was a kid who didn't smoke pot, but I was also a kid who didn't admit that he didn't, because cool kids did. And I was walking home from school with a friend one day, and we're in this little private nook that was a shortcut we would take, and he pulls out his bowl and says, why don't we get high? And I didn't want to. But I also didn't have the courage to say, no, I don't do that. And so I went along with it, and I never felt high. And I eventually learned why I didn't feel high. It's because I didn't know how to smoke. I never smoked in my life. And so, wait for it, I didn't inhale. So, when Bill Clinton was first running for president and people were looking for any reason to negate him, And he always had the political answer. And so if he said yes, he was going to be in trouble. And then if he said no, he was going to lose the cool guy vote. And he gave his perfect political answer of, well, I tried it, but I didn't inhale. And that became a punchline around the country for the longest time of, yeah, I didn't inhale. And I laughed at it too, but knowing it was a political answer, but then also knowing, well, that was actually my experience. But after that, I grew a little spine and then would say I don't do it, but also bought into the fear mongering. So maybe I was a little bit too outspoken about how horrible it was. But that was where I was. And it was just never anything that interested me. I never wanted to smoke. And for years, most of my lifetime, that's all, marijuana was. Do you smoke pot? And I wouldn't smoke it. I mean, you would hear about brownies, and there was a famous Barney Miller episode where they got high on brownies. But I basically avoided it, and that was that. And then the first time I had my surgery for cancer, I had my surgery, and it was a tough recovery, but what recovery isn't? And I didn't need chemo or any of that, and I was back in action. But for my second surgery, the first thing that happened was in the hospital. I was having a very, very bad reaction to the pain medication that I was on. To the point where I lied about how I was feeling to get out of the hospital because I just couldn't take the circumstances I was in, and I didn't want any of the medication. And so I came home in a lot of pain and taking nothing stronger than extra strength Tylenol. And Pennsylvania, by the way, has medical marijuana, but it's recreationally against the law. And someone we know who had a medical marijuana card helped out a little bit by sharing some of what they had. Technically illegal,
Right.
Although I was a patient who would have qualified. But it did nothing for me. It did absolutely nothing. Now, I had pain, I had nausea. I was only sleeping a couple hours a night. My chemo reaction, I mean, once I started the chemo, we talked about in a previous episode, but I had incredibly bad responses to chemo. And I tried what I had. It was in tablet form. There was a little bit of a liquid form. I think it's called a tincture or something, but it did nothing. So I figured, okay, it doesn't help me, or it doesn't work. And, eventually I got through all of that ordeal. But I still have, some lingering pain, not great sleeps, and I've alluded to this, and at some point we'll have to do an episode on it, but it's not something I really enjoy talking about. But the stomach issues, bladder issues, not really bladder, but any issues involving bowel movement, I'd love to meet somebody who has had colon cancer who now has regular digestive patterns, because I would love to know how they do it. So, I started thinking, I qualified for it. Why don't I try it? But it did nothing for me. But who knows? Maybe it'll be different this time or something. Plus, a big thing was that I quit alcohol because I've had cancer twice and it metastasized to the liver. And I thought, I just better get alcohol out of my life 100%. So, you have to, it's, if you qualify, you'll get it eventually, but it's an administrative thing. You have to jump through hoops with paperwork and finding a doctor, who will sign off on it and all of that other stuff. And so tying right into what you said earlier, and I was kind of surprised. I expected you to be a little bit different. I didn't expect you to be so accepting of it so early, not because you're not a reasonable person, but just because what the consensus
when we were growing up,
before the 2000s. Oh, absolutely, yeah. And probably almost every doctor would have opposed it at that time. But anyway, so I went through the process and had a doctor who, with my state, it was easy. It was a no-brainer. I said after the paperwork and the meetings and all of that. But he's telling me, because now understand, I'm 60 years old at the time, and I never got high once. Never smoked a cigarette, never smoked a joint, tried once with a bowl, but had no idea what the hell I was doing, and didn't even feel anything afterwards. And so he's warning me, start small, start small. He said, you're not going to overdose. It's not like alcohol, or it's not like cocaine. You're not going to overdose. But you don't know how it's going to hit you. So just start small. I knew I wasn't going to smoke, and we were talking about the gummies. Well, the gummies are to be held under your tongue. You don't actually chew a gummy. It's not like a gummy bear where you pop it in and start chewing. You actually hold it under your tongue and let the whole thing dissolve. And so I tried that. Nothing, nothing. So I try a little bit more, a little bit more. And what I eventually learned is for a 60-year-old who never got high, I have an absurdly high tolerance to marijuana,
Okay.
like crazy high, that how much it takes to have an effect on me and how long it takes to have an effect. Because the one thing was, well, I don't want to try this till after the kids are all in bed. And then I would go to bed feeling nothing. But what I didn't realize was I was feeling the effects a little bit in the middle of the night. So, to make a long story short, since about the middle of the summer, I've been using, medical marijuana. And, I do have some pain and some issues and some sleeping issues, but I'm not going to lie. I'm basically, it's replacing the couple drinks a night that I would have had. And the only thing I think ridiculous about that is that I had to jump through all of these hoops to be able to do that when it doesn't make sense to me why anyone can't do that. I know said we weren't going to touch on non-medical marijuana, but when you compare it to the dangers that could happen from alcohol, it is kind of an overstep. So I have a card that's just like my driver's license, only it says patient. There are approved dispensaries throughout the state. There are some very good ones in my area. They're very clean. You need to show your card to the camera to get admittance. And then you have another waiting area before you go in. And although you could shop or make requests, there's online abilities to pre-order. But again, I was kind of winging this, not knowing what I'm doing, other than knowing I don't want to smoke. And what also happens, though, is you could get consults
Absolutely.
From the dispensaries that are actually registered pharmacists. So I had a very long phone conversation with the pharmacist talking about, my needs, my desires, and giving me suggestions as to what to use and how to use it. So yeah, that's where I am. I haven't had a drink of alcohol in 5.5 years, but I kind of missed that feeling, and so yeah, I now have a medical marijuana card, and I use it. And it's kind of funny saying that now, based on what I grew up most of my life thinking about it.
Exactly where I'm at. You have a reason, and it fills what you need, and I don't see any problem with it. You're using it responsibly. And that's even people, like we said, this is not about recreational, but even if people are using it recreational, you use it responsibly, just like alcohol. Fine. I agree. People aren't going to go in and become cocaine addicts or heroin addicts. But just like alcohol gets abused, some people are abusing marijuana. And, if you got a medical reason like you do, go for it. I've been a fan for years. I will say, like you said, there's certain doctors that could prescribe it. Even though I was a fan, it was very hard to get the ability to prescribe it in New York. So it was usually pain management people, oncologists, and people near the dispensaries. So I never went through the long process of getting authorized to prescribe it. But I did refer a number of post-chemo patients to doctors who could prescribe it, and I've never had a second thought about that with people who needed it.
And like anything, there's going to be abuse, and the one that I would be worried about, and the one thing the doctor emphasized to me is never until you're done driving for the day. Never when you're going to drive, never with heavy machinery. And again, you can blow a breathalyzer, but you can't always tell if someone is high, and I don't know if they're coming up with tests, and I'm not a big fan of Big Brother and trying to look over what all people are doing, but people in risky situations and in certain professions and when driving, I do believe that there needs to be a better way to manage it, because it seems like the biggest problem now is, well, if it's in your system, when it's used to screen people for employment, if it's in their system at all, they're done.
It depends on
there needs to be a more immediate way.
And I can touch that a little bit. First, you're right. There is no way, if you're pulled over, for example, by a state trooper, for them to know, well, other than doing a blood or a urine test, do you have marijuana in you? I have some very good friends who are state troopers. One of my best friends is, and They actually, when it comes to the difference between an alcohol and a drug evaluation, they have certain troopers in their region that are actually trained for drug evaluation. It's a whole different training that they have to go through because there is no breathalyzer. And like you said, they can do a urine test. If they smoked 2 days ago, they're going to come up positive. So they actually have a testing process that they have to go through that helps them evaluate the signs of driving under the influence. But that's a specific training course, and that's a different form of testing than an alcohol testing on the road. And that your point about when to use recreational marijuana is, I say to people, just like alcohol. If you wouldn't drink alcohol before you drive, don't smoke marijuana before you drive. If you wouldn't, drink alcohol before you go to work, don't drink alcohol before you go to work. Same thing. Now, there are some businesses that, particularly businesses, for example, the one my wife works for, they have an absolute no marijuana policy because they work with government contracts and they work with some security stuff. So if you're thought to be under any influence and you pop positive for marijuana, even though it's legal in New York, that's automatic. You can't work there anymore. You're released, and you can't get hired if you have any marijuana in your system. So, but there are other companies that, they may screen you beforehand. They may just have a policy of, we just don't want you coming in high to work, and that's probably the majority of workplaces in New York.
And even I was a little uncomfortable doing it as a teacher. I did wait until I was retired before I actually got the medical marijuana card. It was kind of another factor in the back of my mind. Not that I felt that it was wrong, but I know that there are enough people that would have felt that it was wrong that a teacher is coming in and teaching after they have been using.
Well, now hold on. I knew even though we weren't that much in touch over 20 years, I knew based on Facebook and the few times we talked, you were a cool teacher in your school. Your students loved you, and the fact of the matter is, you didn't need the marijuana to be cooler.
I did try to make it interesting. High school English is not genuinely the most interesting thing in the world if you don't try to give it a little help. But if you'd like to end on a little bit of an amusing story, I don't know if you have anything else to say, but I could end it on something that's a little bit amusing to wind us down.
Anyone wants to know, I am doing absolutely fantastic. I've been able to restart my Humira for my arthritis. I'm feeling 99% better. My infection is gone, and now all I have to do is wait for my blood clot to clear, and then I can go back on my Leqembi and start therapy probably in about another 2 months.
Oh, great to hear. That's awesome. That's awesome. So as I was saying, for the process in Pennsylvania, you have to go through medical paperwork. You get an approved physician to also okay it. And you also have to get it reapproved every year. It's not infinite. Now, with my diagnosis and my medical history, it'll be easy. I will be. It's more of a formality. But I have to go back to the same doctor that I had gone to originally. And I've mentioned to you that I have a trouble when I have a bunch of things to do. I need a list. I need a to-do list. I need an organizer. And I say it's not official at home until it's on the calendar. And so I was trying to figure out when my appointment was for next year because, I have a card somewhere buried in my wallet, but I'm going to forget about it and I'm going to get a call like, why didn't you show up for your appointment? So we get the 2026 calendar. I want to make sure I don't miss my appointment. I know it's sometime in the spring or summer. So I pull out my appointment card for my next appointment for the medical marijuana doctor, and it is on 4/20, April 20th. So I didn't even have to write it in the calendar. I've got that embedded. I know when my next doctor appointment is. So I'm fine with. I'm comfortable with signing off after that. How about you? All right. All right, we're Friends with Medical Benefits. Please check us out on Facebook, YouTube, Instagram.